Hello, welcome to my frequently asked questions. Today I'm answering common questions about cheek filler, how to avoid pillow face, unnatural appearance, how to get the very best natural looking results. So first of all, what is pillow face? Well, it really is just an unnatural appearance where the face is too round and there's no contours, no shadows in the face, so it just looks unnatural. And there've been a number of celebrities. Madonna was one who was pictured some time ago with just a rounder face from excessive use of fillers around the cheek area. And of course there have been other celebrities as well. Nicole Kidman has always had like a more angular, narrow face, but she has been also photographed with this rounder, softer, fuller cheeks. And really that comes from just a little too much filler around the cheek area that has softened too much, and it means that there's no definition in the face, there's no shadows, no natural contours. So how do we avoid this? How do we get the very best results that are natural looking? Well, with cheek fillers, there are 7 things that we really need to look at. First of all, what is cheek filler? Am I a good candidate for having cheek filler? What are the various options? Let me show you a few of my cases, like before and after photographs. What is the recovery? What are the risks? What are the potential complications from fillers? What is the cost of cheek fillers? And a few of my personal tips. So first of all, well, my name's Dr. Julian De Silva. I'm an oculofacial, cosmetic and plastic surgeon based in London, and facial treatments is everything I do, and I do these treatments every day for my patients. Now this is really for educational information purposes and cannot constitute a consultation. So what is cheek filler? Well, it's a non-surgical technique by which volume is added to the cheek area, and by doing this we can counteract natural loss of volume which occurs with aging, loss of natural fat, and to some extent by adding volume we can lift against gravity. There's also a point on the cheek which is called the beautification point. In medical jargon, well, if volume is added to this area in the cheek and it's around this kind of area here, well, it creates a more curvaceous angle to the cheek, and so that augments something called the Auger curve, which is a very feminine, very curvaceous and beautiful point on the face that adds beauty to a woman's face. So over 90% of fillers that are used now are made out of hyaluronic acid, or they're called HA fillers. And these are like a gel-like substance. And hyaluronic acid exists naturally in the skin, in your joints, and so things like allergies and reactions are really quite uncommon. There are other fillers as well, calcium-based, polylactic acid fillers, but the majority of fillers used currently are hyaluronic acid fillers. So what are these fillers? Well, in a way, hyaluronic acid, it's a gel, it's clear, it's gooey in substance, and you can see in this video, like it's translucent, and it has properties that tend to attract water, and so it can hydrate, and of course it exists naturally in the body. Now, different hyaluronic acid have different properties. Some are hydrophilic, which means they're water loving, some are hydrophobic, and these properties can give rise to different amounts of swelling. And swelling, well, that can make the areas too curvaceous and can give you a pillow face if too much volume is added. So why is the cheek area important? Well, it's a symbolic of youthfulness, feminine and beauty, and we can see this kind of Auger curve in the cheek. It's very feminine and natural looking. Why are the cheeks important? Well, I've done extensive analysis with the golden ratio, looking at what makes a face beautiful, looking at the different parameters and qualities, and this is Angelina Jolie's face, and looking at her parameters, well, measuring the cheek, it plays a very important part in a beautiful face. So what makes a good candidate for cheek filler? Well, if you have depressions or loss of volume, which may constitute from aging, or it can be natural genetics. If you naturally have flatter cheeks, well, you can beautify the face by adding volume. And of course, there are some things to avoid. And if you have festoons or natural swelling, natural malar bags, And it's important to look for this before having filler. Well, in this situation, sometimes it's best to avoid fillers because they can really flare up in these individual patients. And what are malar bags and festoons? Well, here we can see in this patient, there's this like triangular kind of swelling in the upper part of the cheek. And this is relatively mild festoons, but in some patients, this could really swell up with filler when it's injected here because the filler can absorb water. And if you have a natural genetic tendency to have swelling, this can really magnify. Now, sometimes this can be quite subtle, the malar bags or festoons, but it's important to look for this before having filler because this could present like a natural tendency for swelling in the circumstances. So what are your options when adding volume? Well, non-surgically adding fillers in this area can work very well. Surgically, the options are fat transfer, which can be helpful for some patients, and for more definition and longer lasting results, well, cheek implants can also have a role. Fat transfer, well, certainly with patients who have more facial aging, fat transfer can be helpful because it can be added to multiple areas at the same time. And I commonly use fat transfer with facelift surgery to give the best results. So this lady, well, she lost some volume in her cheeks, but also there's some shadowing in these folds known as the nasolabial folds, some changes in the marionettes. And so a combination of lifting plus adding fat transfer to multiple areas works really well. Now, some patients, if you have like a flatter face, well, sometimes cheek implants can really augment this area by giving more definition. However, unlike fillers or fat transfer, cheek implants are challenging in that they are like there's no room really for adjustment in the same way as fillers or fat transfer. We can choose a different size of implant, but we can't vary things like symmetry between the two sides. And all of us have some degree of asymmetry, and this can be a little challenging when it comes to cheek implants because we're not able to correct that underlying asymmetry. So what are the advantages of cheek filler? Well, it's fast, you see immediate results, generally the recovery is minimal, mild swelling and a small chance of bruising. It tends to be relatively comfortable on how it's completed, and generally it's a lower cost than the surgical alternatives. So what can it be used to treat? Well, let's have a look at a few cases. So flattening of the cheek, this patient has a flatter cheek, there's been some loss of volume, there's some mild aging, loss of folds, and using filler along the cheekbone, along the nasolabial folds, well, we've created more definition, we've enhanced the beautification point. At the same time, it looks completely natural. Here we can see from the front, just a slight increase in the ogee curve that just gives the face shape and structure and looks feminine and natural at the same time. Another case, well, this patient felt she lost volume in this area, and volume in the cheek, volume in the mid-face. So fillers we use along the cheekbone, along the mid part of the face, and it's just gently increase the volume while staying natural. As a younger patient, this patient just naturally had like a flatter cheekbone and flatter cheeks, and so filler was used just to augment that area and create more of a curvaceous area of the cheek, which beautifies the face. So what are the actual risks with cheek fillers? Well, the main ones are aesthetic. Overfilling of the cheeks, too much volume, too much rounding of the cheeks creates this puffy appearance that we've seen in many celebrities like Nicole Kidman. But of course, with good filler, it can look natural, and less is definitely more. So what can be done in this situation? Well, we can dissolve the filler. We can use a filler antidote. Hyaluronidase used selectively in these areas can dissolve the filler. However, once corrected, we need to have a plan of action in order to correct this. Now, once the filler's been dissolved, new filler can be added. if there has been a swelling and puffy change, sometimes it's worth changing the type of filler that was used, because different hyaluronic acid fillers have different properties. And fillers that have less hydrophilic, water-loving properties will tend to cause less swelling and give more definition. I also tend to use calcium-based fillers in conjunction with hyaluronic acid fillers because they give more definition, particularly along the cheek and the jawline. They can work in combination and cause less puffiness and more definition. The other thing that can be helpful is the difference in technique. Now, if you've suffered bruising while using local anesthetic with a touch of adrenaline, that will reduce the chance of bruising. Also, in terms of technique, using a cannula as opposed to a needle. Well, a cannula has a blunt end, it will slide in amongst the tissues and cause less injury. And by doing that, it tends to be more comfortable, it tends to cause less chance of injury to a blood vessel, so hence less bruising, and tends to cause less swelling as well. And of course, because it's put in a different technique, it tends to be less lumpy bumpy. And cannula technique is definitely my preference when it comes to this area. But like everything, sometimes you need a needle in order to give the best results in some patients. Puffiness. Well, this is a patient who had puffiness related to malar bags and festoons, and the filler was put too close to the eyes and it resulted in a very puffy and unusual change. And for this lady, we had to dissolve her filler, and ultimately I corrected her with a combination of blepharoplasty and fat transfer to give her the very best results. What is the recovery? Well, about 5% of patients can have swelling for a few days, and there's a low chance of bruising, but we've talked about ways we can avoid that. And of course, expectations are key, because this is an area that can absorb quite a bit of filler. So the question is, how much filler is required in order to give the results? And that means a discussion over expectations. And to help reduce bruising and reduce swelling, avoid things that thin the blood in the immediate period before having fillers, and this includes non-medications and herbal medicines such as fish oils, and certain medicines like aspirin, non-steroidal anti-inflammatories such as ibuprofen. These tend to thin the blood, so we want to avoid these in the week before having fillers. Using ice immediately afterwards can help the chance of bruising, and there's some evidence of avoiding exercise immediately afterwards as well. How long do the results last for? Well, generally we can say fillers in the cheeks will last for 12 to 18 months. And there is more and more evidence that in some people, fillers can really last many years, but we can generally say it will last for that period of time. What about the cost? Well, the cost is going to vary quite substantially depending on who's doing the treatment. Is it a clinician, surgeon? Is it a nurse who's aesthetically trained? The skill of the practitioner, what type of local anesthetic they're using, how much volume is required, the technique that's used, different types of fillers may be used in combination. In the UK, we have the CQC regulation that adds greater regulatory safety to every treatment. However, many clinics do not have this CQC regulation. And fillers can vary a lot in cost, from £250 to thousands of pounds, depending on all of these parameters. So what are my tips? Well, from doing this for many years, my tips are, well, hyaluronic acid fillers are definitely the best fillers in many ways because they can be shaped and dissolved if necessary, but often I use them in combination with calcium fillers because it will add more definition to the cheek and just give more natural results. Cost versus result, well, I would never advise going for the cheapest option because there can be issues with this. There's a natural artistic flair to this, but also we want to avoid some of these issues that we've been talking about. Generally speaking, it is a forgiving area, the cheeks, and expectations, although important, the key thing is really less is more to avoid overfilling of this area. And be cautious if you have any signs of malar bags or natural festoons in the cheek area, because these can be troublesome when it comes to fillers. Surgically, well, a cheek implant, although is an option, it's a challenging procedure, and for some patients, you are going to get a better result with fillers. Fat transfer, I think, is an excellent treatment. However, it's not as precise as fillers, and so it's helpful more with patients with facial aging because it can be added to multiple areas at the same time, and 50 to 60% of that fat survives long term. So I hope this information has been useful. We've talked about what are cheek fillers, am I a good candidate, what are the various options. We looked at some of my cases with before and after photographs. We talked about the recovery, the risks, and how to avoid complications, and we talked about the cost. If you have any further questions or any other points you'd like to raise, please feel free to contact me either through social media or through my website. I hope this information has been useful for you. Thank you for watching.